nurse. Yeah, we came together as a group, and we're just gonna be like asking you guys questions. We're gonna be asking specifically you as a nurse questions based on the book that we were reading.
I'm Isaac Springer. We're all gonna be doing the same thing. So,
I'm Lucy Hawk. I'm gonna do the same thing.
I'm Clara Carpenter.
I'm Abby Vandenberg.
I'm Michaela Smith.
Nice to meet you guys.
I guess we'll go ahead and start with the question.
No, book summary.
Oh yeah, book summary.
So in class, we are reading a book called The 57 Bus, which is based off a true story that happened in Oakland, California in 2013. There are two main characters in the story, Sasha and Richard. Sasha is an agender teen who likes to be referred to as they, them, or their instead of the typical pronouns like he, she. Richard is a troubled teen who goes to a public school unlike Sasha. While riding the 57 bus home, Sasha's skirt was lit on fire by Richard as a prank. This prank got out of control and caused Sasha to receive second and third degree burns from the waist down.
It's terrible.
do you have any other questions about the book before we get started on like the main interview questions?
I don't think so. So Sasha likes to be referred to as they, their, or them. Okay. And the other kid is, what's the other kid's name?
Richard.
All right. Do you often form personal connections to the patients that you treat?
Yes, definitely.
Like what do you feel towards them?
Depending on what they're there for, I usually feel a lot of sympathy for their situation. If it is a situation like what happened to Sasha, I would feel sadness for what happened, and then responsibility for helping them get better.
Yeah.
Definitely.
Second question, how valuable is teamwork while treating a patient, or do you work with others at all?
Yes, but teamwork is probably the most valuable part of my job. There's usually a million things that we have to do at once, especially in an emergency, so it takes everybody to do it together.
Have you ever treated a young child that has been exposed to a third degree burn? If so, how long was the recovery for that patient?
For third degree burns, yes, I have treated patients that have had those. The recovery time is much longer than even their stay in the hospital is, because of the healing and the scarring, and it kind of affects them for the rest of their life.
How long would you say that would last for them to be in your office? For like, what's this estimate amount of time that they would be in there?
For a third degree burn, all of that depends on how big the burn is, but if it's a fairly big burn, they would have to be in the hospital because they don't have their skin to protect them in that area. So the skin has to heal, so it would be at least a week or two.
What is the biggest risk that comes with burn victims?
Pain is probably their biggest issue. Because they're in excruciating pain the entire time you're trying to clean or anytime you try to do anything with the healing process. But then also your skin is your biggest protector, so it affects their ability to regulate their temperature and retain fluids, so they get really dehydrated too.
What do you recommend to past burn victims to help with the trauma?
Burn victims should definitely receive counseling, and then they usually need physical therapy too because the scars restrict their movements.
What made you like kind of realize or want to become a nurse? Like, when did you realize this, and was it like a specific moment that brought you to like wanting to help people like that, or was there anything that?
Yeah, actually, there was a specific moment that doesn't have anything to do with burn victims, but
right.
So Pete is my husband, obviously. We had premature twin babies that were born about 3 months early that ended up dying in the hospital. They lived about a month. And through that process, I became really close with a nurse. Like you said, we get attached to our patients. And she kind of encouraged me to become a nurse.
What has been one of the worst burns on victims that you've seen in your life? What was your reaction to it, and how did it impact you or your family?
Probably the worst burn that I've seen is on a toddler who spilled a pot of boiling water on themselves, and they had burns on their face and all down one of their arms. And little kids are just too little to understand the pain that they're feeling, and treating pain in a burn is nearly impossible because the nerves are exposed. So the biggest impact was just it was like torture trying to treat the baby.
Would you be scared around your kids when it comes to things like that, like boiling water or fires?
Yeah, absolutely. Yeah.
Okay.
Try to keep them away.
When someone's whole body is burned, how is the skin replenished, and for how long does it take?
The time it takes probably depends on a lot of things. Younger people renew their skin cells faster, but they kind of have to regrow all those layers of skin. So the process is long and painful. You have to keep it clean. You have to keep it from getting infected. Sometimes you have to put skin grafts over it, and they have to have multiple surgeries. So it really depends. If they have a whole body burn, that's going to be months and months of treating and recovery.
How does caring two badly burned victims play a mental role on you as a person?
Burn victims are considered one of the hardest patients to care for because of the pain that they're in. So it's very mentally challenging. Most nurses that work in burn units quit after a few months.
Has there ever been an unfixable burn? If so, what did you do to treat it?
I've never seen an unfixable burn, mainly because you can put skin grafts over a burn, but it leads to long-term problems. You know, if you get a skin graft, say on your elbow because you burnt your arm, you'll never be able to straighten your elbow again. So it kind of affects you for the rest of your life.
Can you explain a skin graft? I think is what it's called.
A skin graft is when they use donor skin or
Okay.
skin that they've grown in the lab to replace the skin that's missing.
Okay.
Okay. How long have you been a nurse, and within that time, how many burn victims have you cared for?
I've been a nurse for about 5 years, and I've when I worked on the pediatrics unit, I cared for probably 4 little kid burn victims. A lot of times kids with big burns will go to a special burn unit at a special hospital.
How often do you see burn victims? Like 1 out of every, I don't know, like 100-ish? Is that about it, or is it like?
Yeah, probably small burns, kids that burn themselves on cigarettes or curling irons or stoves.
Uh-huh.
Yeah, it's probably pretty frequently for small burns.
Oh, okay.
As a nurse of a burn victim, like, you're supposed to make sure that they have like a properly good nutrition if they're in there for a while. Have you ever had a victim who preferred a vegan diet? Or if not, what would you do in that situation if they did? Because the character in our book, Sasha, does prefer a vegan diet.
That would actually be pretty difficult because one of the things that they need the most is protein.
Right.
So with a vegan diet, you could use plant proteins, probably a lot of protein shakes, but they would also probably need protein through an IV.
Would you guys, so it could be like, there could be a way for you guys not to feed them meat if they preferred, or
Absolutely.
anything made from animals? Okay.
Do seeing young children with burns have a major impact on your personal character and beliefs?
That's an interesting question. I think that seeing little kids with burns probably increases my compassion and my awareness of the dangers for little kids, especially in a situation with Sasha. It makes me worry about kids today, the things that they do to each other that are terrible.
If someone were to like get burned or like be set on fire, what would the best thing be for them to do like right after that?
You mean like emergency care?
Yeah.
You want to keep the burn wet. So the best thing to do would try to put like wet towels on them until the ambulance arrives.
Alright, so earlier you brought up that a lot of people quit after like a few months. What made you not quit? Like, what made you want to stay a nurse while other people quit?
I think that personally for me, being a nurse is kind of a calling. I think that it's something that God led me to, so that helps sustain me. I also have a lot of friends that are nurses. We talk about our situations, and then just a motivation to help people heal.
Are you primarily responsible for providing pain medications to your patients, or is that someone else?
No, yeah, it would be me.
Okay.
I just had a quick question. You brought up God, so I was wondering, you're a Christian?
Mm-hmm.
Okay, so have you ever felt yourself in like a time of struggle or whatever with your patients? Have you ever found yourself looking towards God as a question and kind of like a leading, like to hope if there's like a really bad burn or hurting?
Like talking with my patients about that kind of thing. Yeah. So I used to work in the pediatrics unit. Now I work in the neonatal intensive care unit. So I mostly take care of babies that are born less than a pound or large babies who are really, really sick. So I think that hope is probably one of the biggest things that parents have for their kids. So it's definitely something that I talk about with my patients a lot is how, God is the ultimate healer and that they can look to God for that.
How long have you been a nurse?
About 5 years.
How much time do you normally spend on a patient?
Well, in the role that I'm in now, I spend a full 12 hours with them each shift that I work. So I stay directly next to my patients the whole time.
Okay.
Okay, so like during the recovery, I know sometimes they get infections. What would you do if like a burn would get infected?
Well, it depends on how bad the infection is. The first thing would be to treat with antibiotics or creams. A lot of times they'll need IV antibiotics. Sometimes they'll have to actually remove the part that's infected and clean it.
Dealing with small children, do you think this plays an impact on the parents? Like, do you think that seeing them in the hospital or seeing them getting treated kind of plays a big mental toll, and they should also be seeing like mental treatment?
Yes, definitely. It's really hard to see your kid in pain and really be kind of helpless. So you're kind of at the mercy of the medical care that's available. So it could be very stressful for the parents.
Are you like responsible for making sure the parents are like okay, like what's happening, or is there someone else who like tells them like what's going on with their kid?
I'm primarily responsible for explaining the care that's being given. The doctors also explain, kind of medical procedures and stuff like that, but I'm primarily responsible for helping the parents feel more comfortable with what's happening.
Has there ever been a time where you could have gotten a serious burn, such as 2nd or 3rd degree?
I've had 2nd degree burns. I've never had 3rd degree burns.
How did you get that? Like, what happened to get those burns?
My burns mostly come from cooking.
Oh, okay.
When you do see a burn victim, a lot of times you can see like some come from like burning houses and something, so the lungs would kind of be filled up with like that smoke and stuff. Do you see often with little kids though? Because the accident that they might provide might not be like more of like a house fire, but it's like a small like water burn from something.
Yeah, a lot of small children, it's mostly like stove burns or them touching something hot. With house fires, smoke inhalation is probably one of the biggest risks.
Mm-hmm.
So a lot of times small children won't survive that.
So sometimes like I know I get them like if I like burn myself somehow and like it was just like a little like bump on your skin, if that makes sense. Like does anyone ever like come in for that? Like did anyone ever try to like come in to get that fixed, or is that just something little that no one cares about?
Yeah, sometimes, especially with little kids, people will bring their kid to the emergency room for that, and they can usually get treated with ointment or something. It's nice if you can get good treatment to help it heal better, but you could go to your doctor's office for that too.
Have you ever seen yourself when you as a nurse like maybe seen a problem or accident, maybe not just with a burn victim, where you think like there's almost like a miracle factor that played, like it was almost just a miracle, like there's no other way that could have happened?
I've seen a lot of miracles, especially with premature babies, that it's a wonder how they're even surviving and thriving and growing as well as they are. It could really only be explained by a miracle.
So if somebody gets like a pretty bad burn, does that also impact their risk of getting skin cancer? Because like you can get that with sunburns even. It can increase the risk of that. Is that?
Yeah, I think anything that kind of changes the natural state of your cells can lead to cancer. I would think that especially getting skin grafts and things like that, where you're using things on your body that are not part of your body, you could be at greater risk for that. I don't know that there's been any studies done about it, but
Okay.
it would make sense.
Do you have any questions for us?
Are you guys enjoying the book?
Yeah.
Yeah.
It's a really good
It's
good,
pretty
yeah.
interesting.
It's a good, kind of like two-sided book. Like you see one side is like the victim, but then you also see the
The other side
so
has
word. Yeah, the others. Yeah, the victim, and then like the person who like hurt the victim. So it's like you kind of see their backstory and what really happened, and see how like it kind of changes your view on it and how you think. And yeah.
How like a lot of times bullies have experienced bullying. that kind of
Right,
thing.
and like why they did that, or what their purpose was for that.
It's good to see other perspectives of situations, for sure.
Yeah, it would be a good topic to like go into debate about because there's so many things you could argue against.
Yeah.
So, you obviously dealt with, have you done like treatment, or have you, took a teaching of like psychological help or something like that?
Yeah.
So would you think, going along with what you said, burn victims or someone who has been hurt by a physical matter, do you think it is really important for them to get some emotional trauma or fix or something like that, so they aren't, kind of like scared, or I don't want to say PTSD because it's probably not that big, but like a trauma? Do you think it helps with that?
Absolutely, yeah. Everything's connected. You know, there's not like a compartment over here for your physical health and then a compartment for your mental health, because you're one being, right? And so
Right.
you're spiritual, of course, you're physical. It's all holistic.
Mm-hmm.
Yeah, there's a big push now for something called integrative care, where you have the doctors would usually look at the physical, and the doctors would look at maybe the mental, even the spiritual, chaplains or things like that.
Would you say that, so like for medical treatment, normally you would have to pay for it. Would you say that it would be expensive for burns, or even in neonatal, am I saying that correct? Or even for that, would you say that it would be expensive?
It's outrageously expensive.
Could you give an estimate of the price?
A lot of our premature babies end up costing over $1 million for their care.
Okay.
So what would you do if a family wouldn't be able to afford that kind of care?
Most hospitals have like charity care programs where they help accept some of the cost. A lot of the kids go on, the premature babies get like Social Security help. So there's help for families out there for that, but it's a big deficit to the medical care system.
Has there ever been a point where somebody just couldn't get the issue taken care of because of the cost? Like they would just have to kind of let nature take its course in a way and see what would happen? Or
I think that does happen, especially with adults. In most pediatric or children situations, there's somebody willing to provide the care even if they can't provide the cost. And especially, at least in this country, emergency rooms are required to treat emergencies whether you can pay or not, so that's good.
okay.
How many years did it take for you to like get the training to become a nurse?
Basic nurse training is an associate's degree, so that's 2 years. I have a 4-year bachelor's degree, and then once you're trained as a nurse and you get your nursing license, usually the training is the training for neonatal care is 6 months, specifically with babies. So it kind of depends on what you specialize in.
But if you want to be board certified like she is across the country, that's an extra 2 years of training on the job plus testing and everything else, and that's a special credential that makes people listen to you.
So, have you ever been across the globe and helped out with treatment, with any accidents or something like that?
Well, our family lived overseas for about 10 years, and we worked, we didn't work with like medical treatment necessarily, but we worked with orphans and refugees, that kind of thing.
Mission trips.
What like continent?
We lived in Asia, where our oldest son was born for a couple years. We lived in Thailand, where we primarily worked with orphans and stuff, and then we lived in the Middle East after that.
So you have previously, before you were had a kid before you were a nurse, because you were being taken care of. How do you think prior to that? Do you think it's easier after you learned all this training? It's easier to treat, like if your kid's saying he feels sick or something. Is it easier to like, because you have that training to like check to make sure they answered it out?
Yeah.
Or?
Nurses are kind of famous for downplaying their kids' injuries and sicknesses. Actually, we're hesitant to go to the doctor, but yeah, it's easier for me to kind of assess whether they're really sick or not. Yeah.
So there's some people that don't believe in modern medicine. Have you dealt with that before? Like,
I have, yeah.
how much does that frustrate you? I just want to know emotionally.
Sometimes it's kind of terrifying. We've had babies in our care where the parents don't believe in things like blood transfusions. We use donor milk for babies. They didn't believe in that, but it's actually life saving. Your baby can die of pretty significant diseases if you don't use those things. So it's actually kind of terrifying. Because you know that you have something available that you can use, but you can't use it because you don't want to go against their beliefs. So, we have seen patients die because of that.
Do you have to force it on them sometimes, where even if they don't believe it, you still make them do it, or is that illegal?
That's a little bit of a complicated question. I would say you can't really force anybody to do anything in this country, so it would be illegal for me to treat a baby against a parent's will. Having said that, when it comes to children, a lot of times what can happen is that the doctor or the state can take temporary custody of the child to prevent them from dying, treat the child, and then give custody back to the parents.
Okay.
Has there ever been like a child that you've come really close to, or like someone that's passed away, like that you've been really close to, and it makes you, how does it make you feel about that?
With children, it's always very sad. We do become very attached to our patients, and especially the ones that are kind of chronically sick and eventually pass away. Emotionally, it's kind of mixed feelings because to some degree you're glad that they're not suffering anymore, but you're also just really sad for the family and really sad that they didn't get to live a full life.
So I know like some people have like autism and stuff. How would that affect treating them? Like if it would because of their like mental state?
It can be more difficult with children, especially if you have to do things like start IVs or put in feeding tubes or things like that, because it's harder for them to understand and cooperate. So we use something that we call child life specialists. That's actually a different job where they're experts in caring for children with special needs and in special circumstances. So we kind of work together as a team to try to help the child understand as best that we can, but then depending on the situation, sometimes you just have to do what's needed.
Do you think that like for those jobs, do you think that kind of takes like a special person to kind of do that, to like take their time into like helping those type of children?
For the child life specialist, yeah, absolutely. They deal with a lot of really difficult circumstances. They have a lot of patience.
So you said you worked with premature babies. How often is there a baby that you can't really treat?
Because they're too tiny?
Yeah.
So it depends on the circumstance. We kind of have an age cutoff where we won't treat. There are babies that are just barely too young to resuscitate. That happens several times a week. We usually go just in case they're wrong about the date, because we attend deliveries of premature babies. So that usually happens several times a week, and then there's kind of a transition period of a couple weeks of the tiniest ones where you're not really sure what's going to happen.
Have you had to ever overcome a fear or something? Like some people are like afraid of blood or something, but is there anything you've had to overcome as becoming a nurse?
I've never had a fear of blood or anything like that, but it's kind of a big responsibility to be responsible for the resuscitation of a tiny person. So we kind of have a couple of year-long period of just anxiety of, can we actually do this? And that's very common with neonatal nurses. I don't know that you ever overcome that. We kind of take the position that a little bit of fear is healthy with tiny patients because they're so unpredictable. So we kind of just live with a certain level of fear. It's scary being responsible for a tiny person's life.
Being a nurse who has to deal with that, with all that fear and like anxiety on you, do you think it helps to seek some help, or maybe just talk to someone, or maybe even be like a Christian and maybe have that faith and that strong faith that helps you get through your job? Do you think that plays a big role?
I would say my strong faith helps me tremendously, just because I do trust that God is in control of what I'm doing, and so oftentimes I will pray before my shift and for His guidance and His strength, especially in those times of fear. I would say that the nice thing about being a neonatal nurse, even though we do have that kind of fear and anxiety, is that we are a very strong team. So we all get along really well and we all work very well together, and I think that we find strength in that as well.
Teamwork plays a big role.
Mm-hmm.
Has there ever been, I'm guessing since they're so young, no, but has there ever been a patient that's been considered transgender in a way where that might get in the way of your medications because it's specific for one gender? Has that ever happened?
When I worked in the pediatrics department, we actually did have a couple of transgender patients. I don't know that I ever experienced a medication issue, because for the most part medications would be specific. I would say if they're taking hormone treatments though for like an actual transition, that could absolutely impact the medication that you give, because your hormones impact everything. So that would definitely make a difference.
So would you say that if somebody was wanting to be transgender, would you say that they probably shouldn't do that since it would mess up medications in a way if something were to happen?
Like if they're sick?
Yeah.
Or do you mean they shouldn't transition?
At all is what I'm kind of saying. Would you go against that?
For personal beliefs reasons, I would be against that. I think if you have to be in the hospital for certain conditions, that would be a terrible time to try to transition your body as well, to a different gender, just because those hormones are strong, and they do make a difference in the way that medication works in your body. So if you're sick and you're having to deal with illnesses, you should definitely not be doing something like that.
So in our book, the character is agender, so they don't want to be referred to as he or she. Is there if you have a chart for a patient, is there an option for them to neither be male or female?
No, we don't have options for that in our charting, just because your actual biological gender does affect testing or treatment, or there's certain things that you have to do with patients if they're a female. For example, if you're a teenage girl, everyone's a teenager in here, I'm assuming, and you're going to have surgery, every teenager who's gone through puberty, a female that has to have surgery, has to have a pregnancy test. So whether you're transgender or not, or agender, you couldn't say, I'm not going to get a pregnancy test for this procedure because I refuse to acknowledge my gender. If you're a biological girl, we would have to do it for safety reasons. So probably biological gender would need to be identified for medical reasons.
So you talked about teamwork, and so what kind of doctors and nurses do you work with?
I work with all different kinds of doctors. We work with neonatologists primarily. Those are the main doctors for premature babies and sick babies. And then we work with a lot of neurologists because brain development is impacted by prematurity or sickness as a baby. We work with pulmonologists because lungs are kind of the last thing to develop, and pulmonologists are lung doctors. One of the biggest risks for premature babies involves digestion. And a lot of babies will die of digestion issues early on, so we work with surgeons and gastroenterologists and pretty much any kind of specialist you could think of.
Has there ever been a case where your team has been split in half on what to do? Some people want to do this, but other people want to do that.
Yeah, we do experience that sometimes with, we've had some babies with pretty severe disabilities, and we will have parents that want us to do everything to keep the baby alive. And so there's been times where some of the staff feels like we're torturing the baby, and some of the staff feels like we have to do everything. Some people feel like we should stop. So sometimes we do run into that.
Has there ever been a point of where you're keeping the baby alive and everything, and the parents also want the baby to keep going, but there's no possible way that it can get off of living off of, what is it called?
Life support
yeah.
machines, ventilators.
Is there a point where you cannot go any farther and you have to, no matter what the parent says?
Yeah, there have been situations where the parents do want us to do more than we actually can do. And so that's the point at which you have to be really sensitive and really good at communicating what is actually happening. Because while sometimes it may look like the baby is breathing or alive, there are times where it's just completely artificial, and if we were to stop actually breathing for the baby would stop breathing. Now, premature babies can't breathe on their own, but they'll try. So the ones that are trying are the ones that we will support. But then there's babies who can't do anything. We've had babies that don't have brains, just different things like that, where it's complicated.
What do you mean, like they don't have brains? Is it not functioning, or do you have to like?
Sometimes they don't develop fully, so they just have like very minimal amounts, like just the part of the brain that controls breathing, for example. Sometimes they're born with pretty severe brain damage because of whatever has happened. So sometimes those babies have zero brain function. You can keep those babies alive for a certain amount of time, but a lot of times we do see that nature takes its course eventually. So,
Do you think have you experienced some pretty bad reactions from the parents based on what the information you gave them about the kid?
Yeah, when it comes to parents, the last thing that you will ever do is give up hope on your children. So if we're telling you that there's no hope, a lot of times we don't get good reactions from that, which is completely understandable.
Do you stay in contact with patients or their family after they leave?
A lot of times I take care of babies a lot of times from birth until they're almost a year old. So I spend 40 hours a week with specific patients for that amount of time, and we do get pretty close to the families.
Does anybody have any more questions, or are we done?
No, I think she answered them pretty well.
Thank
Thank
you.
you,
A
guys.
lot of good questions.
Thank you, guys.
My hands are tired.
Oh, sure.
Take one and pass it around.
Oh, really?
Yeah.
Oh, sweet.
My hands. Can I
Then I
stop
gotta
this? My hands
give
are
some
dead.
to the-